It's easy to ignore problems that affect other people who are far away. The good fortune of being born in a high-income country with advanced medical technology can be easily taken for granted. And problems affecting half of the world can seem too daunting and too distant to matter. But we all share a planet that is getting more crowded each year. Our current population of more than 8 billion people is expected to grow to 9.7 billion in just the next 25 years. Half of these people live in countries without modern health care, holding back billions of people from living long and productive lives. The problems are complex, but Northwestern's Havey Institute for Global Health is finding new solutions every year. The Havey Institute is organized into multiple centers, each focused on a key problem in global health, but all working in concert to create and implement solutions. One particularly vexing issue is that of antibiotic resistance. The World Health Organization has defined antimicrobial resistance as one of the top 10 global public health threats facing humanity. By the year 2050, these resistant bacteria, fungi, and viruses will cause the deaths of 10 million people per year, nearly triple the current rate.
Antimicrobial resistance is when an organism that causes infections, whether that's a virus or a bacteria or a fungus or a parasite, is no longer able to be effectively treated with medications that we would usually use to treat that infection.
In order to better understand how this occurs and how to prevent it, we need access to a wide variety of data on infections. This can be done through genetic sequencing.
All right, this is a high-throughput sequencer. It is used for sequencing entire genomes of viruses, bacteria, or fungi, whatever we happen to be studying. This is a large instrument. It does require some resources, and it can be fairly expensive as well. We have this sequencer here, in comparison, can be carried in a pocket, hooks up to a laptop computer, and all the sequencing is performed on a chip that is inserted within this sequencer here.
Thanks to a generous gift from the Richard and Susan Leddy family, and in memory of Andrew McKenna, Dr. Ozer, his team, and their collaborators around the world are building genetic sequencing systems to study resistant organisms at multiple sites around the world. While the threat of antibiotic resistance is growing, countless other issues are currently present that require the Institute's intervention. In particular, pediatric care faces numerous difficulties from diseases and chronic conditions that make the care of children a high priority in low and middle-income countries.
Interventions are always lacking a little bit behind when it comes to children.
It's for this reason that we have added a new center to the Institute, the Center for Global Pediatric Health.
Really what we're focusing on right now is trying to identify the mechanisms that are causing these long-term complications in order to figure out what interventions can be used not only here in the US, but also in lower and middle-income setting.
If we can address these problems early, we can drastically improve the outcomes for them as they grow. Pediatric care moves quickly into primary care, and understanding the local issues in each country is critical to that mission. Because to build sustainable solutions, you need to understand the unique culture of each partner site.
We've recognized is that if you really want to reach some of these populations, you have to sort of understand what their needs are and what their priorities are.
Through the work of the Ryan Family Center for Primary Care, we are focused on treating health issues at the source. For example, the Institute has established a novel education program for the impoverished children of tea plantation workers in rural India.
who we know the children of tea pickers in Assam tea plantations have very, very low rates of literacy, of graduating school. Could we actually do something that would improve their health through improving their educational opportunities? We've really tried to increase their what we call health literacy, so their understanding of why they should get vaccines and spreading this to the families as well. I mean, we know that if you teach kids in schools about, for example, reducing sodium, they will actually bring that knowledge back, help their families to reduce sodium or other types of healthy behavior. And so our hope is that not only will this help the individual, but it'll also spread to the families, to the younger children, and sort of bring hope as well as health to this community.
Hepatitis B is an infection for which every child in the U.S. receives a vaccine at birth. But around the world, it is still widespread, infecting hundreds of millions of people.
Unfortunately, many countries in sub-Saharan Africa do not have access to the vaccine given for newborns.
Because they are not vaccinated at birth, many adults contract hepatitis B and develop subsequent health complications, such as liver disease and liver cancer.
One of the most exciting projects we had recently funded was a new network of hepatitis researchers. That platform has enabled us to conduct a number of other sub-studies, including testing new diagnostics, which are in development with collaborators in the bioengineering field, as well as data systems, collection of laboratory samples, liver tissue, laboratory tests that help with immunologic work.
As the Havey Institute has grown, the importance of building partnerships with doctors and scientists in other countries has taken on critical importance. In 2025, we opened a new knowledge hub at Stellenbosch University in South Africa, bringing the best and brightest in global health together under one roof.
Well, this partnership is actually 20 years old. So this is really the optimal place for us to set up this innovation hub here in Stellenbosch.
We have business students here, we have our engineering students here, and we have our faculty here.
Our values align, our goals align, and we can go forward much further together.
With the opening of this research hub, we're going to create a wide variety of new avenues to continuing the Institute's mission. As global health work becomes increasingly successful in controlling infectious diseases, we have expanded our programs in addressing diseases like cardiovascular problems. In Kano, Nigeria, a partnership with local healthcare providers is helping us better understand and treat the rising occurrence of stroke in this region. Dr. Philip Gorlick, a nationally recognized expert in the field of stroke in the United States, has joined the Havey Institute in sharing his experience with countries that have rising rates of this devastating condition.
The death rate within 30 days was 30%. This is 2 and 3 times or more the expected death rates.
And this is how Havey Institute, Northwestern University, Chicago, came to our aid.
And so we decided to implement a low-resource stroke unit project. Simple things, low-tech things, but things that can have a really big impact for the stroke patients. They have a lot of really good doctors, they're well-trained, and they really want to do something. But sometimes you need the catalyst. And so I think that's what the Havey Institute has served to do. It is that catalyst.
In countries like Nigeria and Mali, with a lack of access to HPV vaccines and few pap smear screening programs, cervical cancer is the second most deadly cancer in women. This year, a new mobile clinic was opened through the Institute and its local partners. We are reaching thousands with modern examination and biopsy tools through these new clinics, finding disease early and providing treatment. Since the early days of the GHI and the Institute, thousands of our medical students have traveled to global sites to learn and to help.
They're going to become the next generation of global health leaders, but just as importantly, They're going to become better healthcare providers in the United States when they really get reminded in pretty basic terms about why they're in healthcare to begin with.
Sarah McLyman, one of the first students in our Global Learning program, is now a contributor to the Institute herself, spearheading a research and capacity building program in the field of anesthesiology.
In many low and middle income countries, there is no alternative but to perform general anesthesia, which requires that a patient be placed completely unconscious. Their breathing has to be completely taken over. I've been to intensive care units where if you do not have a family member available to squeeze the bag to breathe for their loved one, there's no ventilator.
Dr. McLyman is expanding a program in which she teaches regional anesthesia techniques to doctors in these low-income sites, decreasing the need for general anesthesia while improving local doctors' ability to provide modern anesthesia care to these local patient populations. Every one of our projects started as a seed. But even the most promising seed cannot blossom without support.
The people that work on these projects, they do it nights, weekends, extra hours, because we give them the infrastructure to do it.
It's great to see people get excited about global health because the results are so visible and so palpable and so positive. And it really encourages people to make a career out of it.
In a time when resources are shrinking and needs are increasing, your support is more vital than ever. On behalf of all those countless voices, along with all of us at the Institute for Global Health, thank you for continuing to make a world of difference.